Alex, and I'm going to be performing a head-to-toe assessment on my dear sister Erica, who is my patient for the purposes of this video. I'm going to start with making sure I have all the equipment I need gathered, which I have on me or on the table in front of me. I'm going to provide privacy. I'm going to perform hand hygiene as I come in the room. I'm going to just start by looking her over though when I come in. I'm going to make sure that she has proper hygiene, doesn't have any odors coming from her. When she walks, I'm going to assess her mobility, her gait, observing for any obvious deformities, which there are not any noted. I'm going to make sure she doesn't have any involuntary movements. I'm going to make sure that her clothing is appropriate for the weather, which it is. It's very nice outside today. And I'm going to look at her skin just throughout the entire assessment, making sure it's consistent with ethnicity, no pink or reddened areas or any type of skin tears or anything like that going on. I can start by just looking at her hands, making sure they're not excessively dry or cracked, or if there's any extra moisture, which hers are not. I'll look at her nail beds and they're pink. Testing her recoil, making sure she's perfusing appropriately. And then I'm going to just look at her overall posture and position. I'm going to note her mood, her affect throughout the rest of the assessment. And also I'm going to listen to her speech, making sure it's clear and that she can hear me appropriately. So first we're going to begin with the head and the face. I'm going to observe just her eye contact throughout the assessment, making sure it's appropriate, looking at her level of consciousness, which she's alert, her orientation. So I'm going to ask you a few questions. Can you tell me your full name and your date of birth?
Erica Garcia, 12/27/92.
Can you tell me where you're at?
Your apartment.
Very good. And tell me why you're here.
For this assessment video.
Good. And tell me what year it is.
2014.
Good. Alright, so she's oriented times 4. So first I'm going to look at your head, just your cranium as a whole, looking at her scalp and her hair. And I'm going to feel around, making sure there's no bumps, lumps, any lesions, any tenderness. No. Okay. Going to make sure that her face is symmetrical. Can you smile at me? Good. Making sure that both sides are equal. I'm going to feel your temporal artery. And then your TMJ, can you open and close? Very good. I'm going to palpate her maxillary and frontal sinuses. Any tenderness? No. Alright, very good. So next I'm going to move on to her eyes. I'm going to begin by just looking at the external structures. I'm going to look at her iris, her cornea, her sclera, making sure there's no redness or excessive redness, making sure it's all appropriate, which hers is. I'm going to perform now. First, I'm going to check for her eyes, making sure that her pupils are equal, round, and reactive to light, and that her eyes accommodate. So I'm going to shine this light in your eye, each eye twice. Just have you look at my nose. Making sure her pupils constrict and dilate appropriately. Very good. They are. Her pupils are about a 3 on both sides, and they react equally and brisk. I'm going to have you look at my nose, and then look at the wall behind me, and look at my nose, and the wall behind me. Very good. And her eyes are accommodating. So next, I'm going to perform the confrontal test. I'm going to test your peripheral vision. So I'm going to have you tell me when you can see my fingers, okay?
No.
Good. No. Good. Very good. All right. And next I'm going to assess her 6 cardinal gazes. I'm going to have you follow my finger. I'm going to have you look forward at me and then tell me how many fingers I'm holding up in each direction. 1, 2.
No. 4. 2.
Very good. And then I would have her I would perform the Snellen and the cover test. The Snellen would be the big chart on the wall, making sure her eyes, how far back she can see and read, assessing if she's got 20/20 vision. The cover test, I would have her cover one eye and then the other and see if there's any discrepancies between each of her eyes. And then I would just make sure that she doesn't have any difficulties seeing. I should ask at the beginning if she has any glasses or contacts.
I don't.
Very good. Alright, so I'm going to continue the assessment with her ears. I'm going to be pulling up and back on the pinna. I'm going to be looking externally and internally at the canals. Also checking her tympanic membrane and making sure that there's no rips or tears or anything in that. It all looks good. Have you turn your head? Look on the side. Very good. And then you don't wear any hearing devices, do you? Okay. And then I'm going to perform the whisper test. So I'm going to whisper something in each ear and see if she can repeat it back to me.
Apple. Baseball.
Very good. All right, and then I'm going to now assess her nose. I'm going to first begin with just looking at it, making sure it's symmetrical, making sure there's no lesions inside of it. I'm going to look at the mucosa, her septum, and her turbinates, which I can ask you now, do you know of or do you have a deviated septum? No. All right, so I'm going to take a look. I'm going to moist, and I don't notice any septum deviations. And I'm also going to assess the patency of each nostril. So can I have you hold one side closed, breathe, good, and then the other side. Very good. Any difficulties when you hold each side? No? Okay. And then I will assess her mouth and her throat. I'll be testing her mucosa membranes, her teeth, her gums. I'm going to look at the floor of her mouth. I'm going to look at her hard or soft palate. I'm going to look at her uvula, making sure it's midline, as well as her tonsils, which, do you still have your tonsils? No. Okay, so I won't be assessing her tonsils. And then I'm going to have test her gag reflex by having her say ah, and sticking out her tongue, which tests cranial nerves 9, 10, and 7. So I'm just going to take a look inside. Have you say ah again. Making note of everything that I had listed before. Also, I'm going to take a look at her gums real quick. Good, and they're all pink. She doesn't have any missing chipped teeth. You don't wear any dental appliances, do you? No.
Right.
Right, I'm going to continue the assessment with her neck. I'm going to first begin with just observing and inspecting for symmetry, noting any masses, any pulsations, looking at her JVD, making sure her neck is midline, that it doesn't tilt to one side or another, which would be torticollis. I'm going to feel her trachea and displace it. I'm going to check her thyroid by feeling cricoid cartilage, having her swallow, making sure it moves up and down appropriately. And then I'm going to check her lymph nodes. I'm going to make sure that they are pea-sized, that they're mobile, and that they are not tender. I'm going to start with her preauricular, her postauricular, her tonsillar, her submandibular, her submental, anterior cervical, posterior cervical, her deep clavicular, most people can't feel when you're assessing anyways, and then her supra and infraclavicular. Did you notice any tenderness at all while I was assessing that?
No.
No, very good. I'm going to check her pulses, making sure that they are equal and strong. Her carotid pulses, they are. Very good. Have Have you had any history of any surgeries or anything on your neck before?
Mhm.
Alright, very good. And that's all for the neck. Alright, next I'm going to be doing her chest assessment. I'm going to first just inspect, look how she's breathing, assess her rate, the depth, if she's using any accessory muscles, which she is not. I'm going to make sure that her rib cage looks symmetrical, which it does. You haven't had any traumas or anything to your ribs or lungs. Okay. First, I'm going to feel for any subacute air by assessing the tactile firmness. Place my hand on your chest. I'm going to have you say 99, and I'm going to make sure that the vibrations of the words are there and that they're symmetrical from side to side. All right, say 99.
99, 99, 99, 99.
Very good. In which everything is symmetrical, our left or right side. I'm going to auscultate, listen, start at the inner 1/3 of the clavicle. I'm going to move down to the 2, 4, and 6. I'm going to do mid-clavicular line. And just every time I move my stethoscope, I'm going to have you take a breath in. Very good. I'm going to have you turn around. I'm going to listen to the posterior side. I'm going to avoid the scapula and I'm going to move down to the 1st, 3rd, 7th, and then her lateral axillary line. Very good. And while you're turned around, I'm actually going to place my hands on your back. I'm going to have you take a deep breath in and breathe out. As she's doing this, I'm just measuring the symmetry of each breath, making sure my hands move out and in symmetrically, which they do. As I was auscultating her lung sounds, I was just making sure that there was not any wheezes noted, and that her breath sounds were clear from side to side, anterior and posteriorly, which hers were. Then, if there were any difficulties or abnormalities noted, I could further test with whispered pectroloquy, bronchoscopy, and egopny. And doing each of those would require me asking her to whisper 1, 2, 3, and then I would listen to hear if I could hear her clearly whether or not if she has consolidation or not on her backside. So I'm going to have you turn around. And just so I can see, I'm going to watch her so I can tell whether or not. Okay, whisper. Which, by watching her I can see, but by listening I can't hear, which means there's no consolidation. And then, same for the bronchotomy. I'm going to have you say 99, also assessing for consolidation. Do I need to whisper? You don't have to whisper, you can say it out loud.
99, 99, 99, 99.
Which, as I listened, it was muffled and I couldn't hear her clearly saying 99. And then egopny, I'm going to have you say the letter E. And then I'm going to hear whether or not I hear her saying E or A.
E, he, he, he.
Very good. And I heard an E while I was listening. And then I could do this on the front and the back with the tactile fermitas. And then also I'm going to percuss. I'm going to use my finger and tap around my knuckle. And I'm going to listen to hear if there's a resonant sound or a dull sound, which I would expect to hear a resonant sound. Also, as I am looking her over and feeling around, I'm going to make sure everything is symmetrical, that there's no masses or any pain associated with any of this. I'm going to turn around. And there was no dullness noted. And that's all for her chest. Next, I'll be assessing her heart. I'm going to listen to all 4 valves, and I'll know where I'm listening before I put my stethoscope on. I'm going to listen to her heart sounds, making sure I can hear S1, S2. I'm going to listen with both my bell and my diaphragm. I'm also going to listen to her apical pulse for a full minute and note whether or not her rhythm is regular or irregular. I'm going to start over here at the atrial valve, which is second intercostal space. I'm going to move to the pulmonic, which is second intercostal space. I'm going to move down to the tricuspid, which is the 4th. And then I'm going to move to the mitral valve, which is where I'll listen there for a full minute to her apical pulse. And then after a minute goes by, I can stop. And like I said, I'm just noting that her rate is regular. I can hear S1, S2 sounds. Her heartbeat is strong. Do you have any birth defects with your heart or anything noted in your history?
No.
Alright, very good. Next, we will be moving on to her upper extremities. I am going to feel both her radial pulses, which they are strong bilaterally, and brachial pulses, which I can also feel are equal and strong bilaterally. I'm going to have you open and close your hands, testing range of motion, have you move your arms out, up, down, around, side to side. Any pain or anything associated with that? No. Okay, very good. And then I'm going to look at your shoulders and have you pull up. Very good. Pull down, moving back, forward. Very good. Any pain associated with that? Have you had any previous surgeries, any shoulder surgery, any broken arms or wrists? No. Alright, now we'll be assessing your abdomen, so I'm actually going to get up out of the way and have you lay down. I'm going to begin this assessment like any other assessment in observing first, inspecting her abdomen, and make sure it's symmetrical and contour. I'm going to look at her skin characteristics and look at her umbilicus and note if there's any pulsations. For the purposes of this video, I'm not actually going to have her raise her shirt, just so she can have her privacy still. But I noticed that there are not any masses noted. It looks symmetrical and contour. I don't see any pulsations. So now I will auscultate. I'm going to listen in all 4 quadrants, making sure I can hear her bowel sounds. Also listening for any vascular sounds. I'm going to start in her lower right quadrant, moving from the ascending transverse to descending colon. And I can hear normal active bowel sounds in all 4 quadrants. I'll conclude this assessment by palpating all four quadrants, light and then deep. I'm going to feel for liver, spleen, then I'm going to just explain how to do the scratch test, which I will palpate along, moving up for resonating sounds until I hit dullness, in which I do, I'll go up mid-clavicular line until I hit, again, measuring the distance in between the two, which normal is around 7 to 8 centimeters. And then I will go ahead and feel starting midline and feel for the edges of her liver, but again, for the purposes of this video, I won't, so I don't have to lift up her shirt and expose her. As I palpate, I'm noting any masses or any tenderness. Tender at all?
No.
Okay. Alright. I'm going to continue this assessment by assessing her lower extremities. I'm going to first just inspect. I'm going to make sure that they're symmetrical. I'm going to look at her skin characteristics, hair distribution, note if she has any varicose veins, which you can see here. Good. And then I'm going to palpate her pulses. I'm going to do the popliteal, her posterior tibial, and then her dorsal pedal pulses. So I'm going to feel behind. Good. I'm just noting that they are equal and strong bilaterally. They're not bounding, and making sure they're just a 2+, which is normal. And I'm going to conclude with testing her range of motion. I'm going to be looking at her hips, her knees, her ankles, and her feet. I'm going to also ask if you have a history of any broken bones in your lower extremities, any pain that you have. No. Okay. I'm going to lift your legs, move it out and around. Is there any pain at all? No. Okay. Get down here. I'm going to have you push down. Pull up. Good. I'm going to hold this up. And hold this up. Very good. Alright, and just throughout the whole assessment, I'm going to be looking over her musculoskeletal. I'm going to look at her joints, deep knee bends. I'm going to look at her spine for any scoliosis or kyphosis, range of motion of her spine, her gait, and then I'm going to perform the Romberg test. So I'm going to go ahead and stand up, and I'm going to also have you stand up. I'm going to have you bend your knees. Bend your knees. Oh. And have you bend over. Any stiffness, soreness with any of that. While you're bent over to the side like that, I'm going to feel your spine, making sure there's no scoliosis, which, have you ever been diagnosed? You can stand up. And have you ever been diagnosed with that before?
No.
Alright, and then I'll conclude with the Romberg test, which I'll have her stand here with her eyes open, making sure her gait remains steady. Then that we'll have her do for 20 to 30 seconds. And then going to have her close your eyes for 20 to 30 seconds, making sure that there's minimal or no swaying. If she cannot perform this with her eyes closed, then she would not pass her Romberg test. And today we'll conclude this assessment with a neurological exam. I'm going to make sure that just throughout the whole assessment, her coordination, her skills are appropriate for her age. I can perform part of an NIH stroke scale, but we use those mostly for stroke patients, but just making sure her neurological status is intact, we'll do some of those assessments. I'll have you stick your arm out and then touch your nose, and then your right side, making sure that she actually can make contact with her nose. I'll have you go ahead and lay down. I'm going to test her Babinski reflex, making sure it's not positive, which would mean that her toes flared. Use a sharp object in order to do this. then I'm going to have you put your ankle or your heel on your knee and slide it down your shin on both sides. Very good. And the other side. Very good. All right. Now you can go ahead and sit back up. Very good. And then also part of the NIH scale, I could have her hold her arms out, making sure that there's no drifts, and same with her legs while she was laying supine. I will also just assess her sensation, making sure she isn't experiencing any numbness at all. I'll touch a couple different parts of you. You tell me where I'm touching and if it's on your right or left side, or if I'm even touching you at all. So you close your eyes.
Left leg.
Is it sharp or dull?
Sharp.
Alright, where am I touching you now?
Here now.
Okay.
Left, or right cheek. Dull. Left cheek.
Sharp or dull?
Sharp. Right arm. Dull.
Right, where am I touching you now?
You know.
Okay.
Left arm. Sharp. Right foot sharp. Left foot dull.
Very good. And then, if I had the appropriate tool, I could test all of her deep tendon reflexes. I could do the brachioradialis, the plantar, and Achilles. Just throughout the whole assessment, I'm going to make sure all the actions I ask her to perform are age appropriate. There's some things, obviously, you couldn't ask a baby to do as you could a normal adult, or even modifications for elderly adults. I'm going to let you know that the examination is now finished, and I could answer any questions at this point and note anything, obviously, in her chart, whether or not she has any abnormalities or if she has any concerns. Also, at the beginning, get history, whether or not you're taking any medications.
No.
Okay. All right. Thank you so much for letting me assess.